So yeah, patients often, implants sound quite sort of scary. You're like having something put in your mouth, or and it's surgery. So surgery obviously is a sort of term that people associate with hospital and sort of these sort of things. So what would your advice be on the sort of the surgical sort of expectation? Like how much time you're likely to have off? Obviously it's different cases, but like what's the sort of standard for like a single tooth implant? Like what would your standard sort of post-op kind of expectation be?
So yeah, as you know, it depends. But for a simple kind of non-complicated standard single implant, it would be that it's just take it easy, especially that first day. No brushing, no rinsing on that first day, and just a very soft diet. And just not eating on that area for the first, especially if it's exposed to the environment, sometimes avoiding that area for the first few months there, but no kind of brushing for about the first week or two. Exercise, if it's just a very simple implant, then you probably go, especially for the first week, I wouldn't do any heavy exercise, but if it's not extensive bone grafting, then after about a week, you might be able to do kind of more moderate to exercise. And sometimes you can get back to work if there is sometimes these implants can be, you're not even raising a flap, you're doing minimal interventional surgery, so some people can be back at work, even even after the surgery. Same day. But it does depend. If it was a more extensive surgery, which isn't that's not a routine thing, then you do have to kind of take more time off. And sometimes it can be, for sinus lifts and big extensive bone grafts, it can almost be about a week before you're back at work. But they're very exceptional. It's usually you can be back at the next day or even on the same day. But and our aim is always to make it as minimally invasive as possible, but it really does depend.
Yeah.
Sorry, that's a bit of a politician's answer.